Japanese encephalitis, which was transmitted by culex. In Zika, it is Aedes mosquito. It was first identified in Uganda in 1947. First large outbreak in French Polynesia in 2013. Currently, 28 countries and territories reporting Zika virus local transmission, including India. Causative agent is Zika virus. Disease is caused by Zika virus belonging to genera Flavivirus, transmitted by bite of Aedes aegypti mosquito. Reservoir of infection is not known. In Japanese encephalitis, it was birds and pigs. Transmission transmitted by bite of infested Aedes aegypti mosquito. Usually bite during the morning and late afternoon. Transmission from infected pregnant mother to her baby during pregnancy or around the time of birth is now being seen as distinct possibility. Signs and symptoms, meaning how does Zika virus presents. Incubation period not clear but likely to be few days. Symptoms are almost like dengue, such as fever, skin rashes, conjunctivitis, muscle and joint pain, malaise and headache. Usually mild and lasts for 2 to 7 days. Only 1 out of 4 infected develop symptoms. Infection should be suspected in patients who have traveled in areas with ongoing transmission, with acute onset of fever, maculopapular rash and arthralgia. More investigation is needed for relationship between microcephaly in babies and Zika virus. Diagnosis of Zika infection is through PCR. Virus isolation from blood samples and diagnosis is by serology is not recommended. Prevention. There is no definite cure or treatment for this disease, so prevention is the best way to prevent Zika virus. That is, Aedes mosquito and their breeding site pose a significant risk factor for Zika virus infection. Regular source reduction activities. Vector management through environmental modification, adopting personal protective measures, biological and chemical control at household and community and institutional level. Observe weekly dry day. How the sample is sent to testing. Sample 5 ml blood in sterile plain vial or vacuum container. Time of collection within first 5 days of onset of illness. Transport triple layer package to be sent to cold chain to be sent to NIV Bengaluru National with lab format. Treatment. Zika virus disease is usually relatively mild and requires no specific treatment. People with Zika virus should get rest, drink enough water and fluids, and treat pain and fever with paracetamol. If symptoms worsen, they should seek medical care and advice. Currently, no vaccine is available. How to prevent Zika virus disease? Dose for preventing and controlling mosquito breeding. Cover all water tanks and container with tight lids. Dispose and destroy all unused containers, junk material, tires, coconut shells, etc. Empty, scrub and dry desert coolers every week before refilling. Use larvivorous fish in ornamental tank and houses and hotels. Observe weekly dry day. Empty and scrub all container holding water for a week, like bird bath, flower vase and ant trappers, etc. For personal protection, use bed net at home, hospital during dengue, Zika virus fever to prevent mosquito bite so as to interrupt transmission. To avoid mosquito bite during daytime, wear full sleeved clothing, apply mosquito repellent. For managing fever, use paracetamol. So what should not be done? Don't allow water to stagnate in and around your houses in cooler, bucket, barrels, flower pots, bird bath, freeze trays, coconut shells. Don't throw broken utensil, unused bottles, tins, old tires and other junk material here and there, as Aedes mosquito breeds in these during rainy season. Don't use aspirin to treat fever. There is no specific medicine for this disease. Self medication should be avoided. Consult the doctor. Roles and